Just on testing, before I ask Brett just to speak to the numbers for the day, at some 16,109, that's a little bit less than what we would normally average out at around 20,000. There'll be a number of different factors for that. As we spoke yesterday, movement. Obviously, there are far less people moving around the community. That may mean that testing for some is not as convenient as it might otherwise have been. But the real point that I would make again is if you've got symptoms, even very, very mild symptoms, and particularly given the really clear points that the Chief Health Officer and others have made, with such low levels of flu, if you've got symptoms, then there's every chance you've got this virus. And the best and most important thing to do is to come forward immediately. So as soon as possible after the onset of even the mildest symptoms, come forward, get tested, stay at home till you get your result. If you need support, then obviously these numbers today show you that there's very strong support there for you. We've got to keep these testing numbers up. Now, there will be a trend here over time as we see numbers continue to fall, as we see less virus in the Victorian community, then the total number of people who've got symptoms should be falling as well. But again, I just urge people, if you've got symptoms, come forward and get tested. We've got to keep those numbers as high as we possibly can so that we've got the most complete picture of what's going on out there. This is not a problem at this stage, but it's always, I think, a good thing to remind people and to ask people to play that important part in our fight against this wicked enemy. Come forward and get tested, even if you've got really mild symptoms, because those results not only mean we can put measures in place with you and your close contacts to make sure you're not infecting anybody else. It means we can give you support and assistance if you need that, and it also means that we've got the most complete picture of how the virus is presenting in different parts of the state at different times. That intelligence, that data, is very, very important in terms of making really important decisions, very impactful decisions in the weeks and months to come. I think that probably covers off most of the things I had committed to update you on. There's a few more that are still in train. I think Victoria Police will be out later on today. Deputy Commissioner will be Rick Nugent, I think, will be running you through a whole lot of enforcement data. I'm not quite sure of the exact time of that. I'll leave Victoria Police to inform you of that. And health worker transmission, so all of those, which won't just be clinical staff, but aged care workers, hospital workers, clinical staff, non-clinical staff in each of those settings. We had a long public health meeting last night with all the team. That's getting close to being finished, and as soon as it is, which I think will be by the end of the week, we'll be able to come back to you and just take you through a few of the insights that the data gives us, as well as some of the changes that we're making. Often small things, but they're all about trying to make sure that we keep the people who are keeping us safe from this virus.